Since 2008, UNHCO has run projects supported by the Open Society Initiative for East Africa. The projects have focused on empowerment of communities to demand and participate in improving health service delivery in different parts of Uganda. With this support, UNHCO was able to popularize the right to health and the Patient's Charter with increasing interest and involvement of other civil society actors in Uganda. Institutionally, OSIEA support gradually aligned UNHCO focus towards social accountability, which is now one of the programs in UNHCO's Strategic Plan 2012 to 2017. The current grant focuses on empowering citizens to demand for a health sector that is accountable and relevant, and has so far run 1.5 years since August 2013. Specific result areas include increased citizens' awareness on patients' rights, obligations, responsibilities, and entitlements, demand-side accountability mechanisms strengthened and operationalized in 5 districts in Uganda, intensified advocacy for the legalization of the right to health in Uganda. Increased citizens' awareness on patients' rights, obligations, responsibilities, and entitlements. Under this result area, routine sensitization activities were implemented. Community sensitization involved large group meetings and individual sensitization sessions mainly undertaken at village level during ad hoc gatherings, including border cyclists gatherings, savings groups meetings, water point crowds, and market area gatherings. Community monitors sensitized community members on topics including patients' rights and responsibilities, entitlements, and services delivered at health facilities, feedback and redress mechanisms available at the facilities, including suggestion boxes, health unit management committees, and community scorecards. Drama performances were also staged on various health rights themes at community level. All this were complemented by use of information, education, and communication materials, including posters, brochures, flyers, banners, and t-shirts with health rights and community empowerment messages. Demand-side accountability mechanisms strengthened and operationalized in 5 districts in Uganda. Accountability mechanisms existed at the community level, but they were dysfunctional and were strengthened by the project interventions. Strengthening mechanisms including training health unit management committees, local councillors, VHTs, and health workers on rights-based approach in healthcare, community monitoring, health unit management committees' roles, and basic health policy. The intervention also supported members of health unit management committees to appreciate their role and facilitating their regular meetings to address issues raised in the community scorecard processes and other gaps identified from time to time from suggestion boxes and general health gaps. Community monitors presented the scorecards at district advocacy platforms and displayed advocacy messages at their respective health facilities.
When UNHCO came up with that community scorecard, we were involved on identifying who are the members of the Health Unit Management Committee, their qualities, and actually the chairperson had to identify the real members, and by virtue that they are normally appointed, we had to tell who are those members who had served for long. And we discovered those who had served for long were the people who were staying off the community, they were not inactive. So, for their being inactive, the town clerk had to first keep them aside, got some other volunteers, by choice of the chairperson, they took over. Now we are seeing the purpose of the Health Unit Management Committee.
Suggestion boxes were installed and popularized among the health service users, where they gave feedback about the quality of services provided. In all 10 supported health centers, health unit management committees are functional, and through their work, neighboring health centers have adopted the same interventions. We have seen improvement in transparency and accountability through increased display of primary health care expenditure by health centers. Community monitoring job aids are continuously used by community monitors. They have provided implementation guidelines that community monitors followed to ensure effectiveness in their work. This work has attracted the attention of partners including Ministry of Health and the World Bank. Intensified advocacy for the legalization of the right to health in Uganda. UNHCO has had several consultative meetings on the right to health.
We've more or less enjoyed the right to health. You know that government has been providing for free medical services. The fact that government provides for free medical services, although we have problems here and there because of our resource level, is indicative of the fact that government is aware that health is wealth.
And when that right is denied, one can go to court. And we have seen, we know there are a forest of constitutions in the world that have pronounced themselves on this. But we thought countries in East Africa are better placed at giving us the good ones. But then also, as a country, given our sovereignty, we can also look at phrases that are good to us. And then also, as civil society, because we have consulted, we have had lots of input that have made us arrive at the phrase that I can not pronounce until the...
Which also the Honourable Mover just made now, is that the right to health, whether it is the bill or in the constitution, is going to be very protective of our health workers. When we say the right to health, this is what we are saying, that we need to have our health workers well paid, that we need to have our health workers facilitated, that we need to have our health workers housed, that we need to have our health workers work in an environment that protects our rights. That is where we begin. So we need the health workers to understand this and be able to come along with us. But I also want to say that in our work on the right to health, in my experience for the last 10 years, even our development partners are asking that you want to do this and do this, but where is it enshrined in your legal and policy framework? That is extremely important.
These meetings culminated into the development of the draft Patients' Rights and Responsibilities Bill that UNHCO spearheaded, working together with parliamentarians and Voices for Health Rights, a civil society coalition. The bill will operationalize the Patients' Charter.
We have signed a number of charters, health charters, but operationalizing them is not felt or is not in place. It's the spirit within which we are saying no, we need to amend the constitution and provide for an article that expressly empowers Ugandans to demand for their rights to health. Also, to give patients authority to demand for fair treatment, entitlements when they are getting medical care or treatment in health centers.
The idea of entrenching the right to health in our constitution to a level where the focus is not only on treatment of patients, but also incorporates the idea of preventive measures being taken to ensure that people achieve health conditions that are desirable.
It submitted proposed constitutional amendments on the right to health to the Uganda Law Reform Commission. These propositions have also been shared at the Health Policy Advisory Committee of the Ministry of Health. Press reports also served to highlight these processes to the general public. The project also created a task force to regularly evaluate, assess, and develop key messages on the right to health, which increases citizen vigilance against violations of their rights. UNHCO has also responded to cases of health rights violations and highlighted them for action, such as the dismissal of pregnant students from university.
We are also trying to get in touch with the girls who have been dismissed to find out and understand what the issues are. We are also willing to have a discussion with the university. There are many things, like we said, that need to be understood. One is that as a girl who is at university level, in this country legally you are a mature person.
UNHCO's patient complaint forms have been distributed at Project Target Health facilities. These form a complementary redress mechanism for illegal violations and collect evidence for advocacy for the right to health. Key to note is that these legislative processes take long. It is not a short-term process. It needs continuity for success. Under this project, UNHCO has established a strong foundation for sustainable work that will culminate into an enforceable mechanism for the employment and protection of health rights of Ugandan citizens in the near future.